Coming to diabetes, sadly, it has become the global pandemic today. It's estimated that it will increase to the extent of 55% in most of the countries in the next decade, 10 years. And in some of the countries, including ours, it could increase to the extent of 80% to 100%. And we have become the, kind of the leaders or in the diabetes area. And it is very sad to be in this state of affairs. Also, it could be very challenging to the families, as 25% of their family income could go towards it. And it will also pose a huge burden when it comes to the healthcare systems and economy of the country also. Almost every house seems to have a diabetic, and there is no home without a diabetic today. The problem is the increased blood sugars can be as dangerous as rust sitting on the iron. It can, kind of damage everything inside the body, the blood vessels, the nervous system, on a longer run lead to cardiovascular diseases, brain disorders, kidney disorders, eye problems, and the nervous system. So it becomes very important to ensure that we are doing the right things. The tragedy is it can be prevented absolutely and reversed with simple changes in eating and living. It's not very long ago, even when I was a child, I could see that people spoke in hushed voices when it came to diabetes. They kept it a secret, and they wouldn't like people knowing about it because they knew and they were guilty about, I have done something wrong with my eating and living, and that's why I have diabetes. But today, people speak about it as if they have gained another degree and wear it on their collars and walk around. I've seen in many get-togethers where people talk about, I have diabetes from 20 years. What about you? And this is how the conversation starts. And they're really proud about what's happening. And that is very sad, if you ask me. Well, the goal is to prevent diabetes and arrest the complications of diabetes as soon as possible. And of course, reversal. Is it possible? Yes, reversal is possible because we have created it with our wrong eating and living. And if we correct them, reversal also happens. And we'll learn all about diabetes today in the next 2 hours. Please make a note on all your questions and doubts as we go ahead, and we can discuss them at the end of the webinar. Well, we all know diabetes is characterized by increased blood sugar. Increased blood sugar is known as hyperglycemia, and it's just a symptom of diabetes. Just like a diabetic would have increased hunger, increased thirst, or frequent urination, increased blood sugar also is a symptom. Do we ever deal with decreasing the frequency of urination? No, isn't it? Then why are most of us, most of the time, trying to decrease the blood sugar? Blood sugar is an, effect of something else. It has happened because something went wrong. The cause is somewhere else, why are we dealing with this? This is one of the most beautiful principles and concepts of nature cure. It says, find the cause and remove the cause. When you remove the cause, the effect disappears. It's as simple as that. All we need to do is find the cause of the increased blood sugar and remove it so that the disease disappears. Now, the cause of the blood sugar, increased blood sugar, is insufficient insulin or inefficient insulin. There's a plane going. I'll just take a minute. Now let's take a minute and understand what is insulin. Insulin is a hormone or a chemical released by pancreas. Pancreas is a organ which is leaf-like structure, a small little organ lying below the stomach, which produces and releases a lot of enzymes and hormones which help in digestion of food. It helps in the digestion of carbohydrates, proteins, fats, all of them. So it's a very, very important organ. I would even go to the extent of saying without which probably life cannot exist. It releases two hormones. One is insulin, the other one is glucagon. Insulin helps in reducing the blood sugar and glucagon helps in increasing the blood sugar. Both of them together maintain a perfect balance of blood sugar required by the human body to work efficiently. Now, the next question to ask obviously is, why did the insufficiency or inefficiency of insulin happen inside our body? And the answer is unhealthy eating, living, and stressful mind. We'll take each one of them and see what are the causes and what could be the solution. Let's start with